Joining our medical life session by Medcare Hospitals. We will be happy to answer your questions on today's topic, which is migraine issues and how to deal with it. Migraine is a common issue pain that can go from moderate to severe pain, and I'm sure that it has become more common now, especially with the lockdown, working from home, and even our kids doing their e-learning. So it is very common now. On this topic, I would like to welcome Dr. Anandi Damaduran, Specialist Neurology at Medcare Hospital Sharjah. Dr. Anandi specialized a certificate in MRCP. She will be more than happy to answer your questions, and on to you. Doctor, how are you today?
Yeah, I'm good. Thank you, Dalia. How are you?
I'm good, thank you very much.
Yeah.
Doctor, so during the pandemic and the lockdown, I'm sure the number of patients increased coming to you with between, migraine or head pain, which they don't know or have a name for it, right?
Yeah, definitely. There are nowadays, we are seeing a lot of patients who are coming to our OPD with headaches. Maybe half of them will be migraine, and the remaining half will be a stress-induced headaches also. So quite number of cases has increased after this lockdown, and also working from home, like those things, and even in children due to the e-learning. So it has been, yes.
Doctor, could you tell us more what's the difference between a migraine pain and regular headache?
Okay, see, migraine pain is a headache only, but we differentiate the migraine with the other regular headaches with the help of the associated features. Like the migraine headache, it comes with the headache. Not only with the headache, it has vomiting, it has dizziness, and it has some visual blurring and other things. And the patient will be more sensitive to light, especially the dazzling lights, and they will be more sensitive to sound and even to smell also. So some patients will be having you can say like the petrol smell, even the perfume smell, they also bring these migraine headaches. So when all these associated features or maybe some of the associated features are present, then we say it's a migraine headaches.
And doctor, is there an age for it, and can it affect kids as well?
Yeah, definitely it can affect kids. The kids can be affected especially when the family members like mother or father is having a migraine. Yes, kids can be affected, and we have seen kids as young as 5 years and 6 years with migraine headaches.
If I can stop you here, does that mean it's genetic?
Yes,
Oh.
it is genetic, at least 70% of the cases are genetic.
And how early can we detect that our kids have migraine issues?
See, when the kids comes actually with the headaches, mostly I told you about the typical features of migraine, like headache with some associated features and other things. But when the kids come, they don't have these typical features. They either come with a little irritability or sometimes like a dizziness or only with the headaches like that. They will not present exactly with the classical features of migraine. So what we do actually is, we have to rule out the other possibilities. Like for example, some of the kids can have refractive errors in the eyes, or they may be having throat infection, sinus infection. So we have to rule out all the other possibilities. So they have to check with an ENT doctor, then an ophthalmic doctor, and if everything is clear, then they will be coming to the neurologist, and then only we can diagnose. At the first instance, we cannot diagnose a migraine in the kids because it is, as I told you, it's like a complex presentation.
Okay, and doctor, as we started our conversation, we said that it increased during the lockdown, working from home, being in front of iPads, laptops, all the different gadgets that we have. What's your tip? How can we avoid getting migraine or severe headaches during this time?
See, when we see the work from home, those people, those who are sitting in the office, actually their position, like we say, the ergonomics is good for even the neck pain and the back pain and everything, and they have breaks like that. But when they are working from home, those things are not there. Either they sit in a dining table or they sit in the sofa or somewhere else, and they will be just working on it, and they will be the starting time, ending time, there will not be any there is no cutoff also for those things. So they will be sitting continuously in the computer. And I told you one point before that migraine can be triggered by the lights and the sensitive dazzling light also. So the light which is emitted from the mobiles or the iPads and the computers, they can trigger a migraine headaches. So there is always, like we say, there is a 20 seconds rule. Like just watch the computer, like when you are done with the computer for 20 minutes, take off your eyes from the computer, gaze at a 20-meter distance for 20 seconds and then come back to the computer. So it is just like giving the rest to the eyes from that continuous light. So it's like a 20-second rule like that.
Okay.
For every 20 minutes.
Wow.
If you can't, at least for 30 minutes, you can say.
The doctor, moving out of your workplace, so would walking or doing some exercise break between working hours, would that help?
Yeah, definitely it will help. That's what I said. It is like a continuous monitoring, like that. If that is interrupted, yes, definitely that will help also.
Okay, perfect. And what are the risk factors of migraine?
See, as such, migraine is not a life-threatening disorder, first of all. And the risk factors for migraine, if you ask, like you can put the question as who are more prone to get this migraine.
Yes, that was
that
actually,
is, that
yes,
will be the
my next
around.
question is
who are
prone?
prone for that?
And is it gender or is it
yes,
age or
actually,
what factors
like
would
we
that?
can say women are more commonly affected with migraine. That is first thing. And those people who smoke and those who have like an irregular lifestyle, yes, they are more prone for these migraines.
And why are women considered to be more prone to getting migraine?
Yeah, mostly it is related with our hormones actually, because we do have like a lot of hormonal fluctuations during our, you can say, pregnancy and even periods time. The hormones, some hormones go up, some will go down, and that will be like sensitize the brain to get a migraine attack very frequently. So that is the reason. Even you can say these migraine attacks are very frequent during the menstrual cycle for the women.
And this has any relation to the estrogen level in the body?
Yes, it is.
Okay.
So that is the reason we always tell the women who is suffering from migraine to be cautious about taking oral contraceptive pills also.
Oh.
Because what happens is when they take the oral contraceptive pills and when they have a history of migraine, they are more prone to get a stroke also. Like, the blockage of blood flow in the brain.
Like
so
a blood clots?
Yes, like blood clots in the brain.
DPV.
So they are more prone for that.
Yeah.
So whenever a female patient with migraine history is there, we always tell them to be cautious about the hormonal pills.
Oh, this is a very good point.
Yes.
Yeah. And estrogen pills. So if someone is advised to go on estrogen pills or treatment, would that reduce migraine pain or
No,
not?
it doesn't reduces the migraine pain actually. Even the estrogen and progesterone pills they induce the headaches also. That is one thing. And as I told you, when there is a migraine history, it can promote a stroke also. So it doesn't help actually. But there are like certain medications which low dose of estrogens and other things, and they have to take it with the advice of the doctor with those things.
Okay. Doctor, how can we avoid getting migraine or moving from normal headache to migraine?
See, to avoid a migraine is mainly lifestyle changes, nothing else actually, we can say. So lifestyle changes, the first lifestyle will be the sleep. So everybody has to sleep at least 6 to 8 hours. An average adult has to sleep 6 to 8 hours.
This is a big challenge now.
Yes. Even if you sleep less, like less than 5 hours, or even if you sleep more than 9 hours or 10 hours, both can bring the migraine. It doesn't mean excess sleep is good.
Okay.
Okay, so sleep deprivation also cause migraine and sleep excess also cause migraine.
Doctor, is it the length of hours as a number of hours you sleep or the quality of sleep? Because I hear people, they could sleep 8 hours, 10 hours, but they say we don't have good sleep or deep sleep.
It's more of a quality of sleep actually. When you say like 6 to 8 hours, quality sleep only.
Quality sleep.
Yes.
Okay.
Not like when you are sleeping, and there are so many factors which can affect sleep also. Like you can say snoring and overthinking, like those things also. So it's more of a quality sleep that is needed.
And would change in the diet of
Okay, so
of
that
a
will be
person
the second
help?
thing I'm going to talk. The first
Great.
thing, as I told you about the sleep.
Yes.
The second will be the diet. Diet as such, there is no particular diet, but you have to eat food on regularly. Like you should not fast. So when you are fasting, our blood sugar level goes down, and our brain is entirely dependent on the blood sugar actually. So when the blood sugar level goes down, the brain stops working, and that can induce a migraine also. So eat on time is the most important thing with adequate water intake. These two are important things. And there are certain diets, like you can say excess coffee and cheese and cakes, they can also induce migraine. So in any migraine patients, like it is like we tell the patient that you identify these food items so that you avoid those things. Even chocolates, excessive chocolates can cause those things.
So you put your patients on a diet, a certain diet when they come to you with a migraine issue?
No.
Do you advise them on what kind of food they should avoid or increase in their diet?
No, it is not like that. I just tell them these are the foods that can increase the migraine or that can trigger the migraine. So you need to find out which food is triggering. It is not like all the migraine patient will be triggered by these specific
Okay,
diet.
so something has to come from the
From
patient.
patient to patient it is. See, even I have some Indian patients who has told me that to particular vegetable and even particular fish as a trigger to migraine also. So we say it is like it differs from patient to patient. So you identify your food thing which is triggering and avoid it. That's it.
And you stressed on a point of liquids or fluids and water.
Yes.
So dehydration then would cause migraine.
Yes, definitely. Dehydration can cause, and especially in UAE, we can see like most of us are always in the AC, maybe in the home or in the workplace. We are not exposed outside. So we don't feel that much thirsty actually, and most of us don't drink water also. But it is like our body needs that water, and we have to keep a schedule that you need to drink 2 to 2.5 liters of water per day.
Okay, and does it get better by the years or does it get worse?
Yeah, when the years, yes, it can get better. See, the first thing when a migraine patient comes to the clinic, we always say to the patient that migraine is not treatable. Okay, it is controllable only.
Okay.
So I give an example of a diabetes also. Like when the patient is having a diabetes, like they will be taking lifelong medications. It's not you cannot take the diabetes out from his body. So same like that, migraine will be with them only. It is controllable, but you don't need like continuous medicines like diabetes maybe.
Okay.
So simple lifestyle changes and other things can help to control the migraine also. But in due course of time, maybe over the age of 50, your migraine frequencies can come down.
So talking about the age of 50, so for women it's kind of the menopause time.
Yes. As I told you, it's more of a hormonal things.
Okay.
Yes, during the menopause time, it comes down.
So it increases.
It reduces.
No, I mean the migraine.
Migraine frequency
reduces.
Yes.
Okay.
After 50s.
Okay, doctor, and so blood tests. If a patient comes before knowing he's suffering from migraine, do you put him on certain blood tests that shows that he has migraine, aside from definitely having genetic migraine issues? Do blood tests show?
No, dear. Actually, none of the blood tests shows that you have a migraine or not, actually. The blood test will be like a basic blood test just to rule out the other possibilities which can cause the headaches. Like you can say, as I told you before, sinus infection can cause this one. So we can do some blood test to determine whether there is infections or anything like that as what. But there is no absolute blood test to detect migraine.
So what kind of test do you put your patients on?
Usually we do a scan, like either an MRI scan or a CT scan brain. Even that is also like just to make sure that your brain is normal or MRI is normal, because migraine cannot be detected by blood test or MRI. So this is like basically we are ruling out the other causes which can cause a headache, and then we are treating migraine.
Okay. So we said that it is not curable.
Yeah.
So do you put your patients on long-term medication or treatment?
Yeah, it's a good question actually. See, as I told you, with the example, with the diabetes need a long-term medications. But as such, migraine doesn't need long-term medication. Only in certain cases it is needed. So this is like, I always tell the patient if they are coming to me for the first time to make a headache diary, so that they can mention it like what day they got
this
the
is
headache,
a very good point.
how severe it is, whether it affected her day-to-day activities, and then what did they eat during those times, any stress, everything, like a headache diary.
At which point of the day you start getting so...
So if the headache is like, if they are getting like once or twice in a month, then no need to go for long-term medication. They can just take any painkillers and that's it, leave it off, okay? But if the headache frequency is more than 4 or 5 times in a month, then they may need a long-term medications. So these long-term medications also may be for up to 6 months or 9 months, and in many rare patients we go for 1 year, 2 year also.
So you do say that over-the-counter medication can
definitely
help?
Definitely it
Not
will
treat,
help. Yes.
but can help.
Yeah, can help to relieve the pain.
Yes.
So usually you can say, I start with always Panadol if the patient has not started with anything. So over-the-counter medication, they can start with that. But in due course of time, they may not be able to get control with those medications also. Then there are certain migraine-specific medications are there, which can relieve only the migraine pain. Not like you can say, like paracetamol or brufen, which can be taken for any pain, like back pain, neck pain, and other things. There are certain group of drugs which can be given only for migraine pain. So we do go for that one, like in later stages also, to relieve the pain.
Doctor, stepping away a little bit from medication, home remedies.
Yeah, home remedies actually, like as I told you, they are very much sensitive to light and very much sensitive to sound and smell. So most of the time, if the room is dark and no one is disturbing, and if they are getting a good sleep, that itself will be a treatment for them. And they can keep like ice packs also, no? Like
Ice packs.
yes, ice packs. Like the ice cubes, they can just roll it in a kerchief or something else, and then they can just keep it over the head also. That can relieve the pain. That is one thing. Even some patient, they just tie the kerchiefs around the heads.
This
So
is
that
like our
a child,
our grandmother used to
yes,
do.
even that also will help definitely. So these are like some standard remedies like those things. But a sleep and a quiet room without any disturbances will definitely help.
But one of the home remedies that we used to, that our grandma used to tell us, is to rub Vicks or Tiger Balm and then tie the head
Yes.
so tight
So tight, and it will
until
be
you
yes,
feel like all the veins are popping.
definitely. You can try it. There is no harm in trying those things actually.
Okay, so doctor, again back to the point of the medication or the treatment. So we were told that there is a newer treatment option for migraine, and it's I think on a monthly basis or something.
Yes,
Could you tell us more about it?
Sure. See, actually, like as I told you, when the migraine frequency is more than 5 episodes in a month, we go for preventive tablets actually. Preventive medicines are there. So there are so many classes of medicines which we give for 6 months or 8 months on daily basis they have to take. So nowadays what is happening is there is like an injections are available, which is of like monoclonal antibody we say. So these injections we can take only monthly once injection, maybe the same period like 6 to 9 months like that, and it is definitely helping. And there are a lot of patients with us right now with those injections also, and it's helping in chronic migraine. And when the patient's migraine is on daily basis, definitely it is helping a lot. And the patient also like they feel comfortable instead of taking the medications on daily basis for 6 months 9 months. It's a monthly once injection is really good for them.
Okay, and is there a certain age for it, or it can be taken for kids, elderly
Kids
people?
as such we have not yet tried actually,
Okay.
but adults yes.
Adults.
Yeah.
Okay. Anything with chronic diseases they cannot take?
Yeah, definitely they can take dear. With chronic disease like as you say like diabetes or but then definitely they can take. There is no contraindications for those things.
Okay, good point. Doctor, so we stressed on the point for smokers. So smokers definitely they get more migraine than others.
Yes.
For people who goes to the gym and they do supplements, body supplements, what's the tendency for them to get migraine?
Usually no dear. That supplements doesn't cause migraine actually.
Okay.
So it is no.
And we got a question actually on high blood pressure patients. Are they tempted to get more migraine, or the low blood pressure patients?
There is blood pressure is actually not directly related with migraine, but whenever a patient gets migraine, the blood pressure shoots up actually. So if there is like the shooting up of the blood pressure is like 10 or 20 millimeters, then it's fine. We can say once you relieve the pain, the blood pressure comes down. Okay, but if it is too much, then it is like not, we are not dealing with migraine, we are dealing with something else, and the patient may need an emergency CT or MRI to make sure their brain is perfect. If the BP is too much high and then the patient is having a headache.
Okay, doctor, I got a question now online. What about dizziness from going on car? So people get car sickness.
Motion sickness.
Yes, and motion sickness, especially in car and for long drives. Is this related to migraine?
No, it is not related to migraine actually. It is a balanced nerve is there inside our ear actually, which is connecting to the brain. So if there is any disturbance in that, yes, they can cause the motion sickness. As such, there is no direct relationship with the migraine and motion sickness.
Okay. I have here also, it's not a question, it's more of a comment on the ice cubes. How can an ice cube relieve migraine or headache?
See, ice cubes actually, they constrict the blood vessels actually that are cold temperatures. So that is the reason it is controlling. It's not like what you can say, it's not like a direct mechanism. It is like more of an indirect things.
Okay. Doctor, again,
Yeah.
another question on the newer treatment option. What's it called and how can patient come and ask for it?
The cost.
No, what's the name of it? So there is
That is name is there are so many injections are available, so they can come directly to our hospitals and they can take an appointment. And once we assess everything, like as I told you from the starting, we have to rule out the other possible causes for the headaches. So if everything is ruled out and the patient is really suffering from the migraine headache and the frequency is too high, then we have to send an insurance approval to get those injections, and then we can give also.
So the injections has to be approved by the insurance?
Because it is little costlier.
Okay. And you said how frequently do the patient take it? Is it once a month?
Once a month. It's a once a month, and the injection is also like same like insulin injections, like subcutaneous only. So there are some of my patients, they take on their own itself.
This is the question. Do they have to
Yes.
come to the hospital or they can give it to themselves?
Usually what I say is first injection it is better to take in the hospital just to make sure whether there is any allergic reactions or anything else with those things. Okay. And other injections, if they are confident enough, then they can take it in home also.
Okay. Doctor, when a patient goes to, or actually let me put this question better. When would a patient go to an ENT doctor or neurologist?
Okay,
because the symptoms are very close.
Yes, this is actually a very difficult question, like when to see a neurologist and when to see an ENT doctor. As I told you, like if we say any headaches, the headaches can come from the brain, it can come from the ear, nose, throat, and it can come from the eyes, everything. So it is like only the associated features we deal with that. What are all the patient is having? For example, if suppose the patient is having a severe headache with fever, running nose, obviously he has to go to an ENT doctor with an ear block and something else. Or if he has any visual disturbances, he has to go for an eye doctor. But if the patient is having like a recurrent attacks of headache with vomiting, visual disturbances and even dizziness, it is most probably related with the migraine, and they can come here to the neurologist.
We have a question here about my kid gets blurry during studying time. Is this a sign of migraine or headache or eyesight issues?
What I would say is first to check the eyesight. So they have to go to the ophthalmologist, check whether there is any refractive errors and anything is there. If nothing is there, then they can come back to a neurologist for this.
Okay, another question. I'm pregnant and I get severe headaches. Are these called migraines or headaches attacks from pregnancy?
See, as such, migraine actually during pregnancy, it reduces actually for, you can say 75% of the patient during pregnancy, the migraine attack reduces.
How?
As it is because of those hormones only.
Okay.
So it reduces. But remaining 25%, yes, they can get headaches during pregnancy also, the same migraine headaches. So the treatment is like little crucial because we can't give all the medicines to them. We have to see in which trimester they are, first or second or third. Depending on that, we have to give the painkillers. And also like we have to see whether the patient is having like recurrent attacks. Even the preventive medicines, what we are talking about, the,
would that
the
be
injections
possible for
and
them?
those things, we can't give all the medicines. Even that injections is not suitable when you are planning for pregnancies. So those things we need to assess, and then only we can give the medications.
Okay. So doctor, if we can say, if I can ask you, what tips would you give to people out now to avoid getting migraines or to reach to a point where moving from a normal headache to migraines? Definitely we stressed on the smoking, we stressed on
the sleep
pattern, keep yourself hydrated, moving from time to time, or the 20-second rule for the iPad or the gadgets in general. Would you like to add something else on this
most
part?
Most of the things are covered here. That's what: sleep, food, water intake, and smoking, stress. So stress is most important.
Stress, I think this is one of the things that we cannot help on.
Yes. So those things, yes, definitely. These are the things we have to take care. That's the lifestyle changes.
Doctor, sleeping pills. If a person who tends to take sleeping pills to get him, sleep well, do they cause migraine on the long term?
No, dear, it doesn't cause. Sleeping pills doesn't cause a migraine.
It doesn't. Okay. So I think we have wrapped on most of the questions that we received for the session today. I would like to thank our doctor for being able to address most of our questions here. Thank you so much for joining us. Please stay safe, wear your mask at all time, and wait for us for our next session from Medcare Hospitals. Take
Thank
care.
you.
See you.
Thank you, dear.
Thank you so much, doctor.
Thank you.